All right, so let's dive right into it. So this is Christina Anderson, my wife. She's the founder of Christina Anderson RDN. And so as a registered dietitian, she works with gymnasts on how to properly fuel their bodies. So she started this business about a year ago and it's exploded. She's got a couple employees now and she sees a lot of clients. So I think it'd be pretty value added to get her perspective on management and leadership. Does that pretty much cover it?
Yeah, that's great. Thanks for having me.
Yep. So we'll jump right into the questions. So contingency perspective is a term that's used in this class to describe how you approach individuals differently based on them factors unique to themselves or their environment. So can you give some examples of when you've had to do that in your business?
Yeah, I mean, obviously, I work with high-level gymnasts, but most of them are minors. They're under 18, and so I also have to work with their parents. And so it's definitely a really interesting dynamic and opportunity for me to really lead both of them. Because sadly, often the parents are contributing to some of the gymnast struggles. So not only am I trying to help counsel the gymnast and teach them how to fuel and work through their own food and body issues, but I'm also working through the parents' own issues themselves and helping them, parent their athlete better. And at the same time, that's often, working on some of their own food and body struggles as well that are kind of bleeding over into their athlete.
So can you think of like without names, parent A and parent B, and how you've had to work with them differently to overcome different struggles they have so they can help it better their gymnast nutrition?
Sure. I mean, I definitely, work with a lot of gymnast moms who were athletes themselves or just, being a female, there's a lot of pressure about food and body and kind of how you look. And so oftentimes, these parents will have their own food and body issues that influence their beliefs about nutrition. And oftentimes, a lot of those beliefs they're incorrect. They're not rooted in science and misinformation. And so some of the parents really respond well to kind of the logic and the nutrition education and seeing the scientific research. And that helps them to be able to come around and understand why what they were doing and what they thought was right for their gymnast was actually harming them. And then other parents, that doesn't work as well. They're not as sensitive to kind of the evidence, especially in, today's world with medicine and science, and there's a lot of mistrust. And so for them, it's often coming kind of more of a softer approach and helping them see, and kind of future pace for what they want for their gymnast. And oftentimes they can connect with that and they can relate to, they don't want their gymnast to struggle like they did themselves. And so that will kind of get them on board to make some of the changes that need to happen.
So you'd say that's almost the biggest part of your business is figuring out where the parents are coming from and then how to talk to them to ultimately get them to do what you want them to do to fuel their gymnast.
Yep, exactly. Because even when gymnasts are 18, legally they're adults and legally I don't have to talk to their parents and I can't talk to their parents unless they sign releases for me. But a lot of them, even if they're a collegiate gymnast or elite, Olympic level gymnast, they're still living at home or they're still really close to their parents and still get a lot of support. And there's a lot of influence there. So it's definitely having to kind of find common ground with both of them.
Sure. All right. So for the sake of time, we'll go to our next one. So we talked about a lot about soft skills in the class, like the ability to lead, your attitude, your personality, if you can listen well or not. And then there's the technical skills, like if you can actually be a dietitian or not. So when you're hiring someone, can you talk about both of those? If one's more important than the other, if they're equally important, or maybe one's important to hire and the other's important for a promotion. So if you can just talk about that a little bit.
Yeah, I think, there's a lot of different aspects to my business and a lot of room for delegation and people doing different things. So obviously when you think about insurance, and I bill my clients insurance as a way to help them. And obviously it's financially beneficial to my practice. That position, hiring someone who does the billing doesn't require a whole lot of soft skill because they're not necessarily interfacing with the client versus, hiring some sort of virtual administrative assistant who helps me with what we call discovery calls. So it's a free kind of 15 or 20 minute consult call that I offer prospective clients. if I train someone to do that job, there are a lot of soft skills that are required, because that's really kind of that first impression, that interview of, allowing me to connect to the client, to show them kind of where they're struggling, to really tug on some of those pain points, and then obviously show them the transformation that they could have by working with me. And so, hiring someone to do that part of my job also requires, a lot of soft skills, of being able to listen, kind of pull out kind of what they're struggling with, connect with them, make them feel supported, because that really is an important aspect of the sales part of the business.
So if you had two people with the same technical abilities and you wanted to promote one, which soft skill is most important? Would it be just ability to get the job done, or do they need to be a good listener or
Yeah, I would
attitude?
say if they have the same technical skills in terms of, uploading blog posts and billing insurance and doing those things that really aren't client facing, obviously the individual who does have soft skills to work with clients and interact with parents, would be the one to get the promotion, because they'd be a lot more valuable to my business.
Mhm.
So.
That makes sense. Next question would be, do you have someone who has impacted you and caused you to become a better leader? You can think of one or two, and what was it about them that got through to you?
Yeah. So one of my business mentors, she's an amazing sports performance coach, and she started out just like me, with a private practice, just her. And kind of 4 or 5 years later, she has, a huge business that she's really the CEO of, and she has 6 kind of mental sport performance coaches under her. She has, an online business manager. She has a marketing specialist. And so she's really inspired me to hire individuals and realize that at some point you're going to trade time for dollars. And even though I can do everything in my business, if a business wants to grow and wants to scale, you're going to have to hire, you're going to have to delegate, and really make sure that you're focusing on things that only you can do, instead of doing tasks that you could hire someone to do and pay them, a fifth of the price of what you would be making if you use that hour to really maximize your value.
Mhm. Do you have another one in mind?
Yeah, I have another mentor that she's probably worked with me more on the soft skills, even as a business owner. She does what's called supervision with me. So with some of my really difficult clients who have eating disorders, we meet on a weekly basis to do what we call case consultation, or talk about the situation. And so she's really worked with me on, how do I work with the parents? How do I speak to them? How do I get them on board, while at the same time helping the gymnasts to feel respected and heard, and also meet their needs. And so, that's something that has translated into my own employees, and hiring and training from just what she's taught me with working with clients and prospective clients.
Um, and now it's time for a little self-reflection. So how have you seen your leadership style change from when you first started supervising, or more so in your case, working with clients, to now? So I know you've come a long way in counseling eating disorders. So if you can walk us from where you began to where you are now, I think
Yeah.
that'd be.
Yeah, I think my journey as a dietitian and how I've matured in my counseling skills and my clinical skills has definitely been mirrored in my, skills as a CEO and as a manager. I think kind of starting out as a dietitian and a business owner, I definitely had kind of the former gymnast mentality of just do it. And I often kind of at baseline expect things to be done perfectly. I expect them to be done quickly. And that's just kind of the standard that I hold for myself. But I've realized in working with clients and working with employees that, we all have different strengths. We all have different styles of communication. We all have different expectations. And so it works a lot better if I really kind of compromise with that, versus coming in with this like iron fist and trying to just get things done how I want them done. So I think it's kind of been interesting how both my work with clients, especially with my gymnasts who have eating disorders, which is very difficult, has really translated into how I treat my employees as well.
Right. So in the medical field, your management is not necessarily only your employees. Like you're having to manage your clients almost more so than employees. So do you compromise with them? If you're struggling with a client, how have you evolved in getting them to, I guess, sort of to your end goal of where they should
Yeah.
be?
Yeah, I mean, I think every dietitian, nutritionist starting out has this view that they're the nutrition expert, and that
Mhm.
if you hire us because you have a problem, that you're going to do whatever we tell you to do. But I think any dietitian that's been practicing for a couple of years will laugh at that kind of expectation, because you're still working with humans, and humans have thoughts and they have feelings, and there's often a big gap between kind of nutrition knowledge and implementation. And so I find it's often that barrier, that gap is what I spend the most time working with clients on, and really meeting them where they're at to still get them to point A, to point B. But it's just
Right.
not necessarily a lack of knowledge issue. Sometimes it is, but there's often a lot of other kind of social and environmental and just kind of human factors that play into why they're not able to kind of accomplish their goals or implement, what I've instructed them to.
So your leadership style has evolved a little bit from do what I say because I'm the expert to there's a gap in there somewhere where you have to figure out how to convince them to do what you say. I guess it takes a little bit of growth there.
Yes, and a lot of, asking for permission and asking them and reflecting back to them what they think and what they think will work best, and instead of spending the whole time, me just talking. And I think a lot of us, whether you're a dietitian or a teacher or a doctor, oftentimes we like to come in, we have all this knowledge, we see the problem, we want to fix the problem, so it's almost like this kind of verbal vomit,
Mhm.
in the 15 or 30 minutes of the appointment. Meanwhile, you know that's not connecting with your patient, because there's like three other things that need to be addressed. And if you had stopped and listened to them, you might have heard what was really going on, and that could have taken you a whole different direction.
Right. Is it fair to say a little bit that the right way to lead some of your patients through their eating disorder recovery is to almost make them think that it was their idea, and then like you have what you want them to do, and you talk to them and get them to believe that they have reached at that conclusion for their own eating disorder?
Yeah, I think that's kind of the cool thing in my job of working with high level athletes that are struggling with food in their body, because you definitely can kind of dangle that carrot of their own goals and their own performance and feeling better and being successful as a means to get them to do, therapeutically what I need them to do in terms of fueling their body and not engaging in disordered thoughts and behaviors that are harming them.
Right. And then our very last question, because we're going to run out of time, is how do you motivate an underperforming employee if they are underperforming? Do you sit them down and say they're not meeting expectations, or do you um, I don't know, how do you guide an underperforming employee?
Sure. I think everyone deserves, some chances, because sometimes what I might perceive as underperforming is really, on me in terms of not clearly communicating my expectations and not, giving solid boundaries to the employee. So I think the first step is really sitting down together and trying to figure out kind of what's going on. And obviously, I know what I expect of them, but that might not have translated well to the employee. So they may think that they're doing a great job and doing everything I want, really, because from a management kind of leadership perspective, I've not done my job well enough. And now that might not be the case, but I think it's due diligence to first kind of go through that step and see if this is an expectation, a training, kind of a communication issue. And then at that point, you will have set goals, kind of standards of practice. And if the employee, continues to fall short and not meet those, then that's where it just may be time to figure out if they're really the best fit or not for, the position within which they're hired.
So generally, if an employee is underperforming, it you start with because there's been a communication barrier. It doesn't mean they're knowingly being lazy or doing a bad job. The first step is to make sure things are communicated clearly, you'd say.
Exactly. Exactly.
All right. Well, that's I think that wraps up all the time we have. We appreciate your time,
Of course.
and
Of course.
I'll see you in a minute.
Thanks for having me. Bye.